Today we are going to speak upon diabetes. I and Miraj, my colleague, we're going to go over the link between periodontal disease and diabetes. Type 2 diabetes symptoms often develop over several years and can go on for a long time without being noticed. Sometimes they aren't noticeable at all. Because the symptoms can be hard to spot, it is important to know the risk factors and to see your doctor to get the blood sugar tested as soon as possible. We are going to check today how the literature establishes the link between diabetes and periodontal disease. This can be type 1 diabetes or type 2 diabetes. Also, we are going to check the importance of annual periodontal screening for patients with diabetes. In type 2 diabetes, there is insulin resistance developed. In pre-diabetes, the HbA1c level is normally between 5.7% to 6.4%. The normal HbA1c level is 5.7%. For a diabetic individual, the HbA1c is more than around 6.5%. And high blood sugar can lead to vision loss, kidney disease, and neuropathy. Diabetes and periodontitis. A meta-analysis study in the UK clearly stated that 67% of diabetic individuals are prone to periodontal disease, compared to 35% of individuals who are non-diabetics did not have periodontitis. This clearly establishes the link between periodontitis and diabetics. Another study established the relation between Cal and HbA1c. This was done by Matafsi and et al. So in this study, it was demonstrated that anyone who has an HbA1c of over 5.7 is significantly more likely to exhibit clinical attachment loss or Cal greater than 5 millimeters, and those who had a HbA1c less than 5.7 had less clinical attachment loss. In a systemic review, Graziani and et al. Concluded that patients affected by periodontitis have a higher risk of developing type 2 diabetes than those with healthy periodontium, and that pregnant women with periodontitis have an increased tendency to develop gestational diabetes. So, what are our advantages of understanding the linkage between periodontitis and diabetes, a systemic connection? So the number first advantage is that in a study I found out which clearly revealed that a client who underwent scaling, his HbA1c reduced by 0.4%. Isn't that magnificent? Like reducing HbA1c. So what happens when HbA1c is reduced? The client has more healthy lifestyle, his organs work more efficiently, glucose is like eliminated from the body pretty well, and other systemic conditions are taken care of. So I think we just with a simple scaling, we can reduce the HbA1c by 0.4%. Now that we have established a link between periodontal disease and diabetes, what are our future trends and how do we handle clients who are suffering from diabetes? With the evident bilateral relationship between periodontitis and type 2 diabetes, communication between the medical and the dental practitioner should be bidirectional. Given the significant morbidity of tooth loss as a result of periodontal disease and the relationship between severe periodontitis and increased diabetes related morbidity and mortality, it is recommended that clients with diabetes undergo regular periodontal screening. It is recommended annually with their general practitioner and as well as the dental practitioner in a similar fashion to the annual screening for retinopathy, neuropathy, foot problems, kidney disease, cardiovascular disease, and other risk factors. So, what the author is trying to say here is that we know neuropathy, nephropathy, and kidney disease are a complication of diabetes. What he's trying to say is that even periodontitis should be added as a fourth complication of diabetes mellitus. So this should be the future trend going forward. Diabetes mellitus is a well-known risk factor for periodontal disease, while on the other hand, periodontitis influences the metabolic control and favors development of diabetes mellitus complications. But the link between these highly prevalent conditions is not fully understood. Patients with diabetes mellitus are at an increased likelihood to develop periodontal disease. Other comorbidities such as missing teeth, depression, osteoporosis also positively associated to higher risk of development of periodontal disease. On the other hand, having a higher educational level is associated with lower risk of periodontal disease. I would request my colleague Miraj to take over the virtual podium and proceed with the topic. Thank you.